meet with Democrats this week to discuss how to secure the Affordable Care Act and Obamacare.
Well, he's president until January 20th. And then after that, it's our turn. I mean, he's got to protect what he wants to do, and perhaps you could say his legacy. It's unaffordable, it doesn't work, and it's been crazy.
President Obama heading to Capitol Hill today, rallying Democrats to try and save Obamacare.
Yeah, and on the very same day, Vice President-elect Mike Pence is huddling up with Republicans about efforts to try and repeal and replace Obamacare. So here to weigh in, conservative talk show host Dr. Gina Loudon. Nice to see you this morning, Doc.
Good morning.
Nice to see you both.
So do you buy the White House's line yesterday from Josh Earnest about what this meeting is all about? Let's play it and I'll get you to respond. Take a listen.
There's a lot of discussion about the president's legacy. The president's motivation is rooted in looking out for the interests of the 22 million Americans whose health care would be taken away if Republicans repeal the Affordable Care Act. The president's message will be to encourage them in that fight.
So, Doc, it's not about his legacy, it's about the 22 million Americans who lose their health care.
Well, that's a fraudulent claim because, as you know, more than almost half of the money involved in the so-called Affordable Care Act is actually going toward the bureaucracy and the overhead of that act rather than to the health care of the American people. And so if you were to take that money, for example, and give it back to the people, freeing them to, compete in the free market as we did for many years when people liked their health care a whole lot better, it would not only give people that freedom of choice, freedom to have their own doctor, as Obama promised, and all of the rest of it, but it also would provide for all of the needy in America, and it also would provide for each American family to have a nest egg for retirement. It's $2 trillion that is projected to be saved if it were to go toward the free market and the competitive side of it. And I also think the transparency the GOP is discussing is really important. You look at procedures like cosmetic procedures or LASIK procedures that are totally transparent in costs. We know the costs going into those things. Those costs have lowered over the last couple of decades for the consumer, while the profits for the providers have increased. So this is our model, and President-elect Trump knows these free market concepts. I believe he will gravitate toward them.
Yeah, and Republicans are stressing that, this has kind of become the new lie, where we heard before previously with Obamacare, if you like your health care coverage, you can keep the same health care coverage. This time they're trying to say, all these folks are going to lose their health care coverage immediately, but that really is not the case because they are allowing for some type of transition period. I want to ask a little bit more about Tom Price specifically, who has been nominated as HHS secretary. There's been a lot of talk about Republicans not having some sort of plan to go to. Do you think he in that role will allow for, more of a plan to be put into place? Because he himself had one back in 2009.
I think that Dr. Price is an excellent choice, and I think that he'll put a great team behind him, and I think that he'll put some of the best economists with some of the best medical professionals, and together Americans will have a lot more freedom and a lot more choice in their own health care. Let's remember that this is not really the purview of the federal government. About the best thing the federal government could do for America's healthiness, so to speak, is to get out of the way. This is something that states have traditionally handled just fine, that the free market and competition have handled just fine. And this is something that I think that when President-elect Trump and his team take a look at this, he's going to err on the side of what works. There are models all over the country in different states that have worked really, really well. And I know that they're looking at some of those, and I'm really excited to see Americans have a much healthier future, to be honest.
And Doc, we got a few seconds left, but I'll get you out of here on this, which is there anything President Obama can do to save this?
I really don't think so, but I do think he's going to resort to what he knows how to do best, and that's call a lot of names. But luckily, we're kind of in this It's a Wonderful Life period where it seems like every time they start accusing President-elect Trump of being a racist or whatever, he gets a lot more support for whatever he's doing. So we'll just hope that that's how this goes, that Americans get their freedom back in their health care.
They had that last-minute push for more Americans to sign up, and so we know the direction that was going, because they can use that against them as well. Well, thank you very much for joining us this morning, bright and early.
Thanks. My pleasure. Absolutely.
Well,